Hi, everyone. Welcome to Crushing Doubts Q&A every Monday, 6 p.m. Eastern, 3 p.m. Pacific. It is great to be here with you, and I look forward to answering all of your mind-body questions. So let's have at it. Before we do get started, though, I am going to mention again some of the things that are available to you guys out there. You can go to my website, www.crushingdoubt.org, which has a lot of resources on it that you can check out. There, you can also sign up for my next seminar, which is Monday, December 6th. This is Monday through Thursday for 2 straight weeks. The sessions are 75 minutes long, and I do some talking for about 45 to 50 of those minutes, and then after that, there's Q&A. In that, you get all the information you need about the whole column system. And so if you're still working on it, it really is a great baseline to have. In addition, I do have my group memberships going. These are going very well. These allow us to explore the moment-to-moment experience that people have in the mind-body work and to figure out how they're working with their columns. So these are 2 ways that you can work with me that we are finding to be particularly useful. So let me say hi to some people who are saying hi to me. First of all, Molly Cakes, good to see you. She says, hi, everyone. How is it Monday again? It is really true. Gets her in a blur. Amrit says, hi, Dr. Ratner. Good to see you, Amrit. Okay, we've got Pavla Fleischer, Lucy Odin, Napo, Vasco Leal is here on Instagram, and Vasco says looking forward to for the seminar. He signed up, so Vasco, looking forward to that as well. Can't wait to get started with you. All right, guys, we'll jump in with a preloaded question because often we don't get one in if we don't do it now. So let's bring one up. Napo says hello there. Good to see you. I think that's Napoleon. Good to see you. Okay, this question is from Vivian. She said, this is from a little while back, but I thought it was a very instructive and good question to ask, so that's sometimes I share those here. So she did get her question answered already by me, but I'm answering for the group. Vivian said, I took a trip recently and did all of the work ahead of time. There was supposed to be no period there, I think, to reassure my sense of safety, and it was even a good trip. And yet, I couldn't sleep. The next day, I was a wreck. My pain shot up. And it has taken me days to feel a bit better, though not as well as before the trip when I had made some progress. Is the explanation it's a conditioned response to traveling and doubt is high, or when I'm out of my comfort zone, very local, I feel unsafe and the nervous system goes on high alert? Okay, let's leave this up here because it's a long one. I wanted to bring this one up for multiple reasons. One, I like that the way Vivian is posing it to herself, it captures something about what you guys often struggle with. It's these questions of, is it this or is it this? And a lot of times we are trying to sort that out. So she is asking, with going on this trip and doing all that work in advance and still having the pain, what is the explanation? The 2 questions she has are, or the 2 possibilities are, it's a conditioned response to traveling. In other words, traveling is a trigger to the pain and just naturally brings that up for her, a vulnerability to that. Because doubt goes up high? Or is it that she comes to feel unsafe and the nervous system goes into high alert? So my answer to this question is one that relates to a lot of my answers. There is not a definitive right answer here unless I can have a discussion with Vivian directly to ask her a couple of questions to get at the root of things. But what I can say is there's lots of different possibilities here, and well, not lots, but there are a couple that I can outline. So first of all, it could be either one of those in a sense. In terms of a conditioned response to traveling, it absolutely could be. But the way I think about it really, just to simplify things, is I think about it in terms of the columns. Really, there's 3 potential answers to every question, and they are which column it's in. So it could be an emotions column thing. It could have been that there was something about this trip that she wasn't aware of that was still active and she hadn't nailed the specifics of it, and that's why there was some activity there. It could be a doubt column response, and that one she's already kind of addressed one of the things it might be in the doubt column, which is maybe it was a trigger. Maybe even though she was prepared for it, she just was overly worried about it, like the first time I played basketball after years of not playing. And then it could also be a power column thing where something in your speaking to Vivian here, your system wasn't allowing you to feel powerful, and that was bringing up an issue. So the thing I'll say is you got a conditioned response as one of the options in there. The idea that you felt unsafe and the nervous system goes on high alert, to me, the nervous system being on high alert is not an explanation for why you're having the issue that you're having. That's a response to the issue that you're having. So we got to make sure that we're very clear on cause and effect. And I think in the mind-body field, and certainly in the field of medicine in general, there is a lot of confusion about cause and effect. I do not believe that the nervous system gets out of whack permanently for no particular reason, or that it has a life of its own. The nervous system is always responding to your internal state. And as a result, it's always responding to the columns. So long answer to that question is look at the columns and you can figure it out from there. Hope that is helpful. Let me know, guys, if you need to know more about Vivian's question. We'll jump in from there. Okay, Molly says, doubt is always my most difficult issue, it seems. My mind goes into what ifs, but has been this way for 30 years. So hard to break that habit. And then she's making a later observation. So I'm going to actually just comment on this first, Molly. So I just did in the membership group today, I was realizing something that just is a helpful way of thinking about things. And that is that at any given moment, we are either building doubt or we're building our system. It's always one or the other. And I understand that, you've been doing this for a long time and it's hard to break the habit. But if you can keep observing the ways that you are building doubt versus the ways that you're breaking it down, you will make gains. And let me remind you and everybody else that you just had a big breakthrough, if I'm remembering correctly. You had this burning mouth symptom, which you had for a long time, and it's gone. So what that means is you are starting to win this battle with doubt. You are starting to build your system of success and the system of the columns, instead of building up doubt. So what you want to do is recognize, when am I building a case for doubt and getting myself into trouble? When am I making gains in the system? I hope that helps, Molly, but let's talk more about it. Okay, we have Catherine Toomer on Instagram. Now, she's got a series of things, so I'm going to read this. She says, "Hi, Dan. I'm continuing to be very helped by all your stuff that I can access." Glad to hear that. "Mind-body has worked well to help me lessen and completely change my attitude toward my chronic nausea, and also, to some degree, insomnia and restless leg syndrome, but especially the nausea, which at times was debilitating." Well, coming from me, who has a phobia about that, congratulations. That's good. I'm glad we got that under control, most of all. "Now I have plantar fasciitis. It's the first time I'm trying to apply TMS ideas to a musculoskeletal condition, and all possible doubts have come up. I know Sarno discovered TMS based in musculoskeletal, but I have doubted that a musculoskeletal thing could be TMS in me. Level 2 doubt. That is level 2 doubt, Catherine. Very well articulated. Yes. Remember, level 2 doubt is when you pretty much recognize you've got a mind-body condition, but you're just not sure if that mind-body condition can be better. Now, also, there is some level 3 doubt, because you're saying, I couldn't see it happening in me. But that actually still fits with level 2 doubt, because I'm not hearing doubts about you yourself. Then she said, "My issues have never been around musculoskeletal issues. Nevertheless, I'm determined to treat it as TMS, mind body. When I listen to you all and when I get a bit of relief, I fully believe. But then, maybe I fully believe, but get discouraged easily. Thanks for listening. Any comments? Thanks again. One can't help but love and appreciate." Oh, thanks, Catherine. Very sweet of you. So, first of all, plantar fasciitis is 100% always mind-body. It truly is. This is one of those diagnoses that is getting pushed around all the time in society as a structural issue that is explaining what's happening. If it's helpful to you, Catherine, I have directly cured plantar fasciitis many, many times. So I know this from experience as well. But the other thing I want to mention is the symptom imperative. This idea that Sarno had, another brilliant idea from him, that when you resolve one issue, it can pop up in another issue. So that's something to start to look at as you're conquering doubt and the so-called chronic issues. You're likely to have new things pop up. Remember, doubt is going to try to hide in a new area. So it's now trying to hide in a place it can hide better. And musculoskeletal issues are a perfect place for it to hide for you, because you've never had them before. But you will conquer this as well. And I guarantee you 100% this is TMS. And for those of you wondering what that term is, if you're not sure, that's the term Dr. Sarno used, tension myositis syndrome, for mind-body issues. So, Catherine, let me know if that's helpful to you enough. And if not, we can keep working on it. If you need direct help from me, come to the group membership. We can do that, or the seminars. These things can help for sure. But you also can keep coming back to the Q&A, and I will keep reinforcing. This is 100% mind-body. And when you master this, one thing to keep in mind is you will have taken another step forward in the strength of your columns. Scotty Styles is saying hi on Instagram. Good to see you, Scotty. Napoleon, I will get to your question on Instagram in a second. And Sukante, welcome to the Instagram discussion. But I'm jumping back. And Molly has another observation about what Vivian was saying. She said, Vivian, I totally am that way out of my comfort zone also, especially overnights somewhere else. With stepchildren that are adults, I can get really feeling powerless. Actually, I think that's a separate issue. I'm going to get to that in a second. Let's talk first about the comfort zone thing. We all have our comfort zones, and it is very important in the doubt column to know what is likely to bring up a trigger, what scares us. Now, what scares us doesn't mean we have to be ruled by that and not go along with certain activities or not do them at all, but it's just good to keep it in mind. In that question with Vivian, I think if it was a trigger, if it was a conditioned response, then that just means there was more work to be done, not just ahead of time, but in the moment. And maybe that's an important part of what happened and what she said. She said, I did all this work in advance, and then I still had some issues, even though it was a great trip. Well, a lot of times that means that the moment of the experience you were having, there was something going on. Remember, moment-to-moment thinking is so important in this. I say this all the time, but it really is important for you to remember. If you're having some kind of issue, check the moment you're in. It's always moment-to-moment. There's no permanent solution to this, even though there's no permanent chronicity. You can get rid of chronic pain and chronic symptoms entirely, but you're going to need to keep working in the moments. Okay, Karen Isaacs, good to see you here. She says this: I had a wedding Friday. I was anxious I'd wake up with a headache. I'm better at envisioning feeling good, but Friday I felt bad. I was proud of myself for going about the day, meditating, not caring. I just let it be. Let's see. Hold on one second. Then she said, and no surprise, I went to church, felt bad, got to the hotel, settled in. By the time I got to the party at 6 p.m., I felt great. I danced. I didn't drink, which is fine. I didn't drink because I was scared the headache would come back. So, Karen, thank you for sharing this story. What it illustrates is just how scary these things can be for all of us. I have coming up, I'm actually getting the booster shot for the vaccine. And you guys may have seen the video that I did on YouTube of getting my second vaccine. And there were so many triggers during it. And I don't know what was what. I don't know what was caused by the vaccine side effects and what was caused by my mind-body experience. But what I do know is the mind-body experience is incredibly powerful. It is usually the most powerful thing in almost anything. So I think what Karen's describing here is something we've all felt at various points, where we're really grappling with, okay, I got to do this thing. Could it bring up a symptom? What I want to do is keep expanding our powers in this. Funny to use the word power because I'm not talking about the power column. I'm actually talking about the doubt column. But we work on all the columns. Within the doubt column, Karen did some good work here. She pushed through. And she didn't just push through like, oh, well, I'm just going to do it and hope for the best. She pushed through but did work. She did work on a moment-to-moment basis to keep working at it. And you can see in this journey, things changed over time. And she was able to feel great at certain points. She was able to dance. Now, whether she wanted to drink or not, if she decides that ultimately she would want to, then we can push through that too. And the fact is, every time we push through a trigger and we do it successfully, we gain that confidence. So you can keep building your confidence. But Karen, good job. Okay, Molly has another observation. With stepchildren that are adults, I can get really feeling powerless. Do not know why, since they are nice to me. I almost said not nice, just assuming in the step parent situation. But then she says it's so stupid. So Molly, one thing I want to say to you, just to encourage you, is that nothing that goes on for any of you is stupid. I know you kind of meant it tongue in cheek, but I kind of feel protective of you here, where I want to say, try to think about your columns as the idea that you always make sense. You always make sense. So whatever's going on there, it's not about necessarily whether they're nice to you or not. It could just be about insecurity about the position. So many of you know this, but I was adopted by my father now, who I do call dad. I've called him my dad since I was 3 years old, I think. So ever since I can remember, he does sometimes to me have this feeling of not being like a biological father, or maybe not taking on the full role of a father at certain moments, but he certainly plays the role of father. But he's got, I think, some insecurity there because he just doesn't have that connection in the same way. And meanwhile, I have insecurity in that family. I often feel like, when we're in a group, I don't belong as much. So don't underestimate the fact that when the relationships aren't set up in that biological way, you could just have insecurity about it, and that brings down your power. But you can work on it. And I think that's a great topic to bring up. So thanks for bringing up that topic, Molly, and showing that vulnerability. And then she says, I am with no burning mouth, still all good. Beautiful. I mean, that's fantastic. Okay, I'm going to get to Napoleon's question from Instagram. He says, I have so many, hold on, I have to see what this is. I have so many proofs and exceptions, I think it is. I have symptoms after COVID, almost all gone. The last weekend, I was hanging out with some friends and I was totally free. Once I was alone, the gut sensations came back. Even with all this, I still have sometimes I have doubts. I wonder why I'm still jumping to it. So, Napoleon, we're all going to go through the exercises our minds go through. One of the reasons I really like the way I've set up my system is it sets it up in such a way that who you are is accounted for in it. It is something that can be worked with in these situations. So try not to question what's happening in your mind. Similar to what I was saying about Molly about the stepchildren experience. Whatever's happening in your mind is happening for a reason. So the job is not to question why is this happening, certainly not in a critical way. You do want to ask why it's happening in a curious way, though, where you can say, I wonder why. Now, what I'm hearing in Napoleon's question, just for everybody out there listening and watching this, is that this all really depended on doubt. This is a doubt column issue. It goes up and down. The symptoms are going up and down based on belief system, because he's saying, I was fine when I was hanging out with friends, but once I was alone, the gut sensations came back. I would read that as doubt came in when he was alone. Doubt is going to come in when it can. It's always going to be trying to come in the back door in some way. So keep an eye out for it, and let's keep discussing. Okay, Chronic Inspirations joined as well. And then Catherine, you said remnants of the other issues. I think that was, I'm going to go back and see what that might have been in relation to. Okay, I think the first part of your message, Catherine, may have gotten cut off. So let's reload that, and I will get to you. Or if I missed something, please do let me know. Okay, and Molly says, Karen Isaacs, that is great, but next time have a drink or two, LOL. And then she said, have a drink on me. All right, you guys have to link up for that one. I can't help with that. Molly did say, I won't bring up nausea, LOL. However, I did have plantar fasciitis, and it went away too. I had that last year and then got the burning mouth, but that is gone too. So, doubt is going to try to settle into some symptom. It's always going to try to settle into a place where it can make a home, essentially. And we just aren't going to let it. I say all the time, you have to be very determined to beat doubt, and that means you keep working at it. You never stop working at beating doubt. Molly's example of the burning mouth actually is an important one, because she had that for some time, but she finally got it. And now, doubt could try out some kind of symptom imperative thing, but often it starts to give up that sense. It starts to give up wherever you win. So if it can't get you in a symptom, then it's going to try to get you in a thought, in some kind of worry. And you just want to keep looking out for doubt in all of its forms. Remember, Doubt can also come in terms of hopelessness or frustration, or it could even come in trying to convince you that the system that we have going somehow doesn't work. So it's going to try to get you in every way it can, and you just keep hammering it. It's like whack-a-mole, and it does pop back up, but it becomes a lot less work over time, and we just keep working at it. Okay. Tusif Cal has joined us on Instagram. Good to see you. And Catherine, again, on Instagram, Catherine Toomer. I didn't see the beginning of that question, so if I did miss something, please do let me know. Okay, Linda Alarde has joined us. She said, hi, Dan, couldn't get Wi-Fi connection, but it seems that she has now, so that's good. Then she said, I am very suggestible, so I told the person giving the vaccine not to tell me what symptoms to expect. Oh, good job. Yeah, that's a good idea. I just told her I'll get whatever you tell me, so please say nothing. Beautiful. Then she said, I had no symptoms after dose 1, 2, or the booster, which I got with a flu shot, not even a sore arm. But never give me an expectation. Deadly for a highly suggestive person. Really brilliantly put, Linda, and instructive too. She did work on her own behalf, and this is something that I do very frequently. I don't let people give me triggers if I can help it. Sometimes they do, but I work hard not to have that happen. In fact, when I took my daughter for her COVID vaccine, the nurse started to say something, and she got it out before I could even say anything, but then walked away. And I turned to my daughter and I said, don't listen to her. Those things do not happen necessarily to everybody at all. And my daughter knows about the mind-body stuff. My 12-year-old really gets it. But even so, it was already out there. And I was like, why did they have to say that? So Linda did a great job here, jumping in and not letting that happen. By the way, Linda, you had let me know by email about a really cool thing. I'm going to leave it up to you to bring it up, but I'm just going to say generally that Linda had an issue that seemed incredibly structural in terms of connection to pain. And she really used the work that we have done, or that she's done with her own mind-body experience, to get past that pain. So pretty cool. But if you want to share the details, Linda, it would be very instructive. No pressure to do so, but okay. Then she said to Molly, Linda did, so happy, Molly, that you obliterated that burning mouth symptom. And Molly said, thanks, me too. Okay, Sylvia Sierra, good to see you here. She says, hi, Dan. Just wanted to say, I think noticing my time stress has maybe helped. I did get one migraine, but was able to notice it was related to time stress. So that was okay, and it didn't last long. Beautiful. Sylvia, I'm really happy for you. And this is a good illustration of how getting more specific makes the difference. So, Sylvia, I think it was 2 weeks ago, or it might have been last week. The weeks do really fly by, and I can't quite remember. But Sylvia had talked about kind of a form of doubt that we noticed. And as we talked about, and my recommendation was, let's get more specific. And when we did, she realized, the timing of the symptom really did come up with a feeling of there being time stress, pressure of time. I think that's what you were saying, Sylvia. And now she's reporting back and saying it helped. It brought down the doubt. Here's the thing. When you nail something specifically and you just know in your heart of hearts that it's true, doubt goes down, and then the symptoms go down. And I think that's what happened, Sylvia. You know when it's right. And that doesn't mean you know when it's wrong, by the way. It's not necessarily the opposite, but you really know when you've really nailed it, especially because the symptoms tend to respond. Okay. Put pain in the past. That's Rita. Good to see you here, Rita. Thank you for joining us. Rita was in one of my interviews with Tamara, and she talked about complex regional pain syndrome. She is a great ally in this work together. We got into a nice, healthy discussion with a particular person on YouTube about certain doubts that they were having. They were having very strong doubts, and they were bringing it very strongly. And Rita helped me stand our ground and show, hey, you're bringing too much doubt here. We need to label it as such and work on that. So great job as a community, and I thank her. All right. Now, Molly says, since my BMS has gone, I believe more in the system. So BMS is the burning mouth syndrome. Yes, BMS. Okay. I had to figure out the acronym there, but it makes perfect sense. So in a way, it was a gift. I hope that makes sense. Yes, it really does. It makes huge sense, Molly. The thing is, there's nothing more convincing than results. That's just a fact. And I understand that. And one of the things I like about my system is it does tend to produce pretty good results. That here's the other thing, actually. When it isn't producing results, at least I can give a reason for it. And it's a reason that makes sense. And more often than not, that reason then does free you up to get results. And I think, Molly, we did that. You weren't necessarily getting the results of the burning mouth syndrome going away, but you stuck with it. I kept giving you reasons for why it wasn't going away yet, and we got there. And so it's not only going to help you, I think, for the rest of your life to have that success in your back pocket and remember and know that you did it with this system, but it's going to help other people too, because people can watch these and be like, oh yeah, she thought that wasn't going to go away or was, having doubts, and boom, it did. Okay. Karen Isaac says, yes, next time wine. I used to be a big drinker, horrible headaches. Now that I'm not needing to self-medicate as I used to, I'm fine going to a party and not drinking, but I don't want to not drink because of fear. So yes, it's important for us to not be stuck in fear, but it's also important for us to recognize that certain things from our past can be triggers, and not just triggers in terms of conditioned responses, but they can be emotional triggers. If you're doing something that you used to rely on and it brings you back to that time, you can get into a position where your power goes down, your doubt goes up, and you're just not feeling so great. So I think, we want to strike the right balance where you're not afraid to do the things you want to do, but you can also recognize there may be some things from the past that you're just like, I don't want to have to deal with that. And I've evolved a lot as a person over this time working with my system and since my back pain. But, I would say the last year has been spectacular in terms of its growth, just from me using my own system and talking to people about my system and finding its usefulness with them. That builds up my confidence. That keeps us going. And then we work together to keep everybody's confidence rising about this as we get a very comprehensive, clear system that's making sense of what we're seeing. So, I do want to thank you all for sharing these things. It's wonderful to spend time with you in this way. Then Molly said, not to knock nurses, but some can really be the Grim Reaper. Yes. I say this about doctors too. There's certain people just in general in society who are just handing out triggers everywhere they go. And they don't realize, but it's a form of aggression. They're walking around being like, oh, I'm going to make you worry, and I'm going to make you worry, and I'm going to make you worry. And they can be really nice people, actually, but they're having an aggression problem that's kind of leaking out in that way. And I think that's very frequently happening in the medical field and with nurses sometimes. Some of it may be that the anxiety of what they're dealing with there, and I'm not saying that to excuse anything, because quite the opposite, actually. I want to push back against that tendency. So what Linda did not only protected herself, but it could put the idea in that nurse's head or whoever was working with her, oh, you know what? Maybe I should be careful about that. And maybe I should say, do you want to know the side effects that can sometimes happen for some people? I mean, wouldn't it be great if they were mind-body educated and they said, okay, listen, I can tell you the types of symptoms that might come up, but we need to remember they could be mind-body symptoms. And as a result, you may not want to hear about them at all. Wouldn't that be amazing? Well, that's part of what we're working towards here as I continue to get people educated about this and spread the word and get this whole system out to more and more people in a variety of ways. That would be great. Okay, Linda said I can talk about her experience. Thank you, Linda, for allowing that. So here's what she said. Happy to share, Dan, if it helps others. Leg pain started in May at a stressful time along with other symptoms. The other symptoms resolved, but the leg pain got worse, 7 to 9 sometimes. Ultimately, at an annual exam, my doc was examining the leg and sent me for an x-ray. Next day, I get a message, you need a new hip. I was shocked and went through the 5 stages of grief: anger, denial, bargaining, etc. Finally, after reaching out to 3 TMS docs, I know, she says, you know who they are, Dan, and I do, I had to accept it. After about a week working with Dr. Strax and an SE therapist, I realized the pain had dropped around 75%. Surgery is scheduled November 29th. The hip is not supporting weight. It truly has seen better days, but releasing the uncertainty, doubt, and feelings of self-recrimination stopped, and the pain is a 2. Now, this is a really instructive thing. It's one that we can talk about at length as much as anyone needs. There are going to be times, listen, I think that almost all surgeries are not necessary at all. But there are going to be times where there's some kind of restricted mobility or problems with that, that doctors are going to recommend going for the surgery. I don't trust people who are not mind-body practitioners, though, who recommend surgery at all. I immediately am like, nope, let's go to David Hanscom. Let's go to John Strax. Let's go to David Schechter. Let's go to Dr. Rashbaum. Let's go to somebody who can actually engage with this work while understanding the mind-body principle, at least to some degree. Otherwise, there's just, to me, those kind of recommendations make no sense. But the fact that all of these TMS people were saying, oh yeah, that's the kind of thing that can happen with this. I want to make an important distinction about that. That is never to do with pain. Ever. Never, ever, ever. So even if you're getting a recommendation that you might need some kind of surgery to allow for mobility or to be able to, support your weight, things like that, that's possible, but pain is never going to be an issue. Meanwhile, Linda, I'm just going to say this, going a little bit out on a limb to say this, but I do like to speak directly about what I think so that people can get the help that they need. Usually surgery relates to mobility and flexibility and absolutely nothing else. So the idea of it not supporting weight, I just want to put it out there as something you could potentially challenge. That might be a mind-body thing because it's so worrisome, and that makes it behave in a certain way. In my experience, mobility and flexibility, that's the kind of thing that can relate to these kinds of surgeries. But interestingly, the pain does not at all. And that's why I wanted Linda to bring this up. She was having terrible pain. And she even got, I think, even more worried when TMS doctors were saying, oh, I think you do need this surgery. And that makes sense that she would. But as she was working on it, she actually got the pain to go down to 2 without surgery. What does that tell you about the surgery? It has nothing to do with pain. To me, Linda, what that means is that pain can go down to 0 without any problem. I've been meaning to say hi to Jasper. Jasper Hitchcock came on Instagram. He said, sorry, I'm late. It's never a problem, Jasper. It's always just good to see you. Let me know how things are going if you'd like to. Really good to see you. And Sarah Igo, Healing Journey, joined as well. Good to see you, Sarah. Okay, let's get to this Instagram observation or question. Napoleon says, oh my God, yes. Actually, this new wave of symptoms started when I was told that someone else has it, and I saw a meme about it. This is so real. Thank you, by the way. I want to be more curious about this. Okay, so Napoleon, sometimes in these conversations, I lose the thread of what you may have been responding to at that moment, and I apologize about that. But mostly what I'm hearing is you are recognizing that people can provide triggers in what they say, and you're going to watch out for that. And it is so real, extremely. So keep up the good work. All right. Molly says, but we need to just not let it affect us. We will never change people and their behaviors. Wish we could, but being realistic. I believe she's referring to when people give out these triggers. I agree with your stance on that, Molly. I mean, it doesn't do us a service to hide from the world and feel like we can't handle that. I just think you want to develop a protocol with yourself so that it doesn't bother so much or doesn't take over so much. And that's really what I do. At the same time, Linda shutting that one down was great. Okay. Mark R. Hello. Hardly ever make these when they are live. Excited to be here. Good to see you, Mark. Mark was on a testimonial session with me on the podcast. And he was somebody who used the podcast, only the podcast, had no interaction with me otherwise, didn't do any of the readings or anything, and he got better from that. And now he's getting interested in getting more deeply into this work. So, Mark, welcome here. Good to see you. Okay, from Instagram, Catherine Toomer says, your statement that my plantar fasciitis is 100% mind-body just erased the rest of my doubt. Thank you. Awesome. May still do membership groups for more detail with plantar fasciitis and also remnants of other. Okay, there's the remnants of other issues part. That's great, Catherine. And I'm glad it helps. I think one of the things that I'm aware of that can be helpful is sometimes me being reassuring really does help people tremendously. But one of the reasons that it does is I'm very careful to be trustworthy, and I build that so that every time there's something that, sorry, my earpiece is having problems here. Every time that somebody has a doubt and I'm going to be reassuring, the more trust I've built, the more trustworthy I am, sticking to science and logic, continuing to make sense, having my system not be contradictory, even when it seems like it is, to have an explanation. That's part of the reason that my words can actually matter. So, Catherine, I'm so glad that it could, and we'll keep moving forward. You just let me know what you need. Sarah Igo says, hello, thank you. Good to see you again. So thanks for saying hi. Okay. Tusif Cal says, hi, Dan. What is your membership program? Is it offline recorded videos or live group chat? Okay. These are live group Zoom calls. And what they are is we basically go through different moments and different experiences and understand them through the columns lens. So it is a kind of moment-to-moment in-life discussion to understand the system. And I'm finding that it's very helpful. These membership group sessions, they are not recorded. The seminars, however, are recorded. So if you're looking for something that you can go to that is live, but then also have as a resource, that's a good example of something you can do. If you can't attend the seminars, though, you can actually order them just on video. And people have gotten help that way, too. Many ways to get help. Okay. Molly Cake says, my uncle, who was a doctor, told me he never knew of a surgeon who did not want to perform surgery. Scary, but true. Yep. There are going to be plenty of doctors out there who they're stuck in their rigid mindset. They're not being thoughtful enough about this. And I'm sorry to say it because it may sound very critical, and it actually is critical. I don't agree with that sort of thing. I think they need to be very, very thoughtful about what they're doing because they're in a very important position and they can influence a lot of people. Okay, Karen Isaac says, Dr. Sarno and TMS therapist Dan had on Dr. Fliegler, Kirsten Fliegler. Okay, sorry, I read that awkwardly. Dr. Sarno and Kirsten Fliegler, who was her therapist and somebody I had on the podcast, they both said I didn't need hip replacement. Then Dr. Rashbaum was on the fence about it. He said I had severe arthrosis. I had hip replacement 9 years ago, no regrets. Okay, so first of all, no regrets is the key part, because the fact is, whether you have the surgery or not, you're going to be fine either way. Now, sometimes people need the surgery for mobility and flexibility purposes, and that's probably what Dr. Rashbaum was referring to. I do want to say, sometimes even these wonderful TMS doctors may be playing it safe in a way that could push doubt a little bit, and so we may want to explore it. But either way, you got nothing to regret, Karen, as long as you feel good about the way things went. And meanwhile, listen, my mom, she struggled with this. She was told to have a shoulder replacement, but she knows my work and she talks to me about it. And she felt so horrible. She was like, how can I go through with a surgery when you think that, you should never go through with the surgery? And I was like, wait, hold on. I didn't say you should never go through with the surgery. What I said is you do not need to go through with surgery to get rid of the pain and the symptoms. But she was having mobility issues. So she went ahead and got it. It did help with the mobility, but it helped with another thing. And I'm not recommending surgery in general, but I'm just saying, you've got to know you. If the surgery is going to reduce your doubt because you did it, and then that's not an issue anymore, that could be something worth it. So just consider that. Okay, Jasper says, working on past doubts, but didn't realize how I put my doubts in a future that has yet been written. Yes, you're going to have doubts about the future as well. You can have doubts about the past, you can have doubts about the present, you can have doubts about the future, and they all happen in the moment. So keep working on that, Jasper, and great observation. Please do share more about it. Okay, Linda says, those are the docs I went to, the ones I mentioned, Hanscom, Strax, and Schechter, I believe. sent them my images. They confirmed it, but I was amazed that the pain dropped so much. I did check it out. The femur head is ground down to a stump. Yuck. David Hanscom, as a former surgeon, was so affirming, and I feel comfortable with the decision now. Today, pain is 0 to 1. So, see, I think this is an example where sometimes the decision to have the surgery, as long as it's not connected to your sense of that's the thing that needs to alleviate pain, it could be that this is just taking away some doubt. And meanwhile, even more doubt is gone now, Linda, because the pain went away before the surgery. So we know the surgery is not required for pain. Today, pain is 0 to 1. You were having a lot of pain with this, so this is another big success. Thank you for sharing. Linda says, Karen, glad to hear you have no regrets about the surgery. When I walk, I dip down because the bone is collapsing. Gross. I know this is impacting the other hip, which is just fine so far. Tough decisions. So one thing I want to say, one more observation about that. Dr. Schechter and Hanscom told me my hip won't get better and will compromise the other hip. They were not surprised removing uncertainty helped the pain drop off. Okay, so I'm always going to say if I don't agree with a certain thing just to help with something, what Linda's saying makes a lot of sense. What she heard makes a lot of sense with one exception. And that exception is this idea that it'll compromise the other hip. I'm sorry, but I think that's completely wrong. I think that is introducing doubt. That's extremely unlikely. Your body has gone through millions of years of evolution. It can handle all kinds of things. So I'm not saying that they were wrong to say, hey, I think you need the surgery to get the mobility and stability of that hip back. That's fine. But we know that doesn't cause the pain. I agree with them that they should not be surprised that removing uncertainty helped the pain drop off. Totally on board with that. But as a compensation issue on the other hip, Linda, try not to worry about that. I just don't think that's true at all. But we can talk more about it. Okay, Dorisa, good to see you here, Dorisa. She says, I also had plantar fasciitis and it went away too. Then she said, I had hip surgery and now my hip is fine. Just visualize a great outcome. Okay, great recommendation. The other thing that I'll say is everything's moment to moment. So even if you're having trouble with it at one point, that doesn't mean you're stuck there. We can get you out of it because every moment is a new moment. And this is another way that, again, my seminars and membership groups can really help with that. You've got these resources. And I know I've been saying I've been writing this book for some time, though I actually did make good progress on it this weekend. I couldn't make as much progress on it because there were just things I had to help with first. And one of them was to get the seminars up and then the membership groups, because it was necessary to take good care of people. So I had to do that first. Book comes next. I'm making good progress. Okay. Karen Isaac says, Dr. Dan, you are always spot on. Thank you, Karen. Appreciate that observation and confidence, but I appreciate even more that I'm saying things that feel really good and spot on to you. That's important because it can help you with your doubt. Molly Cakes is making the observation. Some people are addicted to surgery, which is really sad. There's all kinds of addictions. It's really true. And my heart goes out to those people, of course, and I'm sure Molly feels that way too. The whole idea that they just feel like they can't get a fix. They can't get things better. And what I have been saying a lot recently is it's helpful to remember there's no magic bullet. And we really should give up this idea of a magic bullet. But that doesn't mean that chronic pain and chronic symptoms can't be cured. They all can be. Absolutely. It's just that they have to be worked on moment to moment. And the column system allows you to do it, and it will eventually allow you to do it pretty automatically. I don't think about my columns in such a conscious way now. It's ingrained in who I am. And ultimately, that's where we're getting to. I think as people make gains, that will happen. Linda will worry less about the pain because of what just happened. That's going to take away any worry that, can the surgery cure the pain or not? It's totally irrelevant. The pain's basically already cured. Or Molly's burning mouth. That went a long way towards building this into an automatic experience. So I'm seeing it everywhere with people. Or Mark, in terms of what happened in terms of watching the podcast. Or Dorisa having plantar fasciitis and it going away. We have so many examples over and over. Sylvia is another one that noticing the specifics of that time stress changed things. So we're getting evidence across the board. We just keep getting more evidence. Positively Whitney has joined on Instagram. Good to see you. Jasper says, I am trying to focus on a future without fear and doubt. Also that I'm not broken and am not in pain. And am not my pain. meaning it's not something that defines you. Good observation, Jasper. If you need help, you know where to find me. I think if you are having any trouble, any of you out there, the membership groups, none of the things that I do require you to be there for a long period of time. You can dip in and dip out. And that's one of the reasons I wanted to have that available to people. So one last question, then we'll finish up for today. Linda Larde says, visualizing playing with my granddaughters and not only sitting on my butt, I miss walking with them. All the doubt is gone. Thinking of good outcomes. Fantastic. Having the pain go first is brilliant. Makes all the difference. Looking forward to normal movement again. Lynn, I'm so happy for you that this pain went away before the surgery, because it will make it so that the surgery is not tied to pain going away at all. So beautiful outcome. I'm proud of this community. I love this community. You know, we've got a bunch of some of the best people. Goodists are my favorite people. You do not need to change being a goodist, but you got to challenge. You got to channel it in the right way, and we'll keep working on that. Napoleon has one last question he wants to squeeze in on YouTube, so I will squeeze it in. He says, can I ask you one more thing? What are your thoughts about long COVID? Could be in many cases just TMS. In my case, seems to be the case. Listen, we can debate this. We can discuss it more, but I will put I'm always going to say what I think, you know, and some of it is going to be controversial. People might argue with it. I don't care, as long as I'm providing good service to all of you and I'm sticking to my points in a way where you can believe in what I'm saying and I'm consistent. I'm going to do that. Long COVID, in my estimation, unless it's related to some major medical condition that like affected the lungs or something like that, which I have not heard about, long COVID is always TMS. It is mind body all the way, 100%. The minute I heard of this, I was just like, well, what are the chances that it isn't mind body? I mean, there's a huge belief system going on and triggers and worries and all kinds of things. I could have predicted long COVID, because there's so much worry. It just makes all the sense in the world. So let's discuss it more as needed. And Napoleon, if you want to come back next week and bring that up again, or if anybody else does, let's have more of a discussion about it. But I'm going to say very definitively, as I tend to be about things that I feel comfortable saying things definitively about, that long COVID is mind body for sure. Guys, thank you so much for joining me. Once again, if you need help from me, the next seminar begins Monday, December 6th. It is a great way to get all of the information you need and stop the endless search for all of the information where you're combing through things, because I bring in the best information from all of these different programs as I see it, and I fit it into this one system, and it allows you to stop searching for things over and over. Then in the meantime, my membership groups do allow you to have some moment-to-moment interactions with me so you can figure out what's going on with your symptoms and how to master them. Okay, guys, thanks so much. We'll be here same time next week. I hope you all have a happy Thanksgiving. I send my best to you, and I will see you same time next week, 6 p.m. Eastern, 3 p.m. Pacific. Thanks so much.